Okay, so next up, we want to look at treatment of heart failure in children. So of course, this treatment, we're not trying to go, around everything you actually need to employ for you to be able to treat heart failure in children. All right. So we're not going to discuss in depth on anything. We'll just list them. This is an overview. Then later on, we'll still come back discussing every classification of the treatment. Okay. So moving forward, you can see here, consider prescription medications like beta blockers, reduce your salt intake, maintain a healthy body weight, that's don't get obese, change your diet to include more fruit and veggies, talk to your doctor about if any surgeries will be, useful in treating that, So principles, first of all, if I want to treat heart failure, I'm trying to actually reduce the workload on the heart. Of course, it's a workload that is making the heart to fail. I'm trying to improve myocardial performance. All right, that's heart muscles and making them perform better. I'm trying to correct any underlying issues. Then general measures. Okay, so for the treatments, general measures is the person should rest more. So the bed, that's the head of the bed will be propped up. Don't lie on a flat surface, okay? It will be raised to like 45 degrees. So tube feeding for very sick infants and young children. Give oxygen when needed. Reduce fluid intake to about 75%, all right, of maintenance. So medical treatment, they can use diuretics because such a person is having issues of fluid volumes in the body is kind of like much, you understand? So they actually use diuretics so that you can be able to put out that fluids. So furosemide, thiazide, spironolactones, okay, digoxins, all of these they use it if the heart is failing, okay? So you want the heart to contract more, beat more. So it will increase the force of contraction, it will slow the heart rate, it will decrease the conduction through the AV node. Then other positive inotropic agents like dopamine and dobutamine can also be employed. Phosphodiesterase inhibitors like milrinone and enoximone, all of these could actually also be employed. Then vasodilators, they act by reducing the systemic resistance, thus the afterload on the heart. Okay, so drugs like what? Hydrochlorothiazide, nitroglycerin, prazosin. So then basically they are making the blood vessels to like open up so that blood can flow smoothly, so that there's no resistance effect on the heart. Okay, so other drugs that can be employed include beta adrenergic blockers in patients with cardiomyopathies. Then you should always look at anything that is actually causing that heart failure, all right? Then try to treat it, or any other complications that came up during the heart failure, you try to address it individually. Okay, so that's it.